And you'll see, oh, hello, it's the 5th of October 2022 and it's a month since I've had my lip surgery. I've got a bit of makeup on, but I've left the scars and the lips. I haven't actually put a bit of lip stain on, but I've left the scars unmade up so you can see. There you go, see? Can't talk very well, my lip's still a bit stiff. I had a bull nose lip lift, is where they cut a bull nose shape out underneath your nose and cut a piece of skin away and sew it back together. A Vermillion Lift, where I think that is here as well, that they kind of, that is included in tucking that out. I had a corner lift, which is when they slice a little bit out here and sew that back together to lift the corners up a little bit, and a V-Y Plasty on the bottom lip, where they cut a section out of your bottom lip on the inside to push your bottom lip out. Okay, so that's what I had done. I had that done with Bran at GB Aesthetics, and I'll put the address down below for you if you're interested. It cost £6,000 all in all, which included the consultation at the beginning, and it will also include a few consultations after and a couple of treatments if I need it. I think it was either microneedling or something, I don't know, we shall find out. I probably won't need anything. But why did I choose Bran? Is because I researched him. That is key when you're getting any surgery done. Research, and make sure that you feel totally confident with that person. Surgeons seem to specialise, this is what I discovered. Most plastic surgeons seem to specialise in a few things. Greg specialises in nose jobs, lips, and lowering the hairline. Hello, Pixie. And lowering the hairline. So that's his specialty, and he does fillers and injections, and I'm sure he does other bits and pieces too, but that's his main specialty. He also has a good library of videos, chats, talks and images on Instagram, so you can see a good range of his work, and actually just seeing him talk you can really sense how professional he is and how knowledgeable he is too. And there's also some patients that are showing their experience and giving him the thumbs up, which is always useful. So he isn't going to give you the sausage lips, so if you want great big sausage lips, that's a no-no. It's all about looking natural with Bran. And I had hoped that the corner lift would help my horrible marionette fold things here, my baggy skin, but he was very clear with me and said it wouldn't really help those, and he could try Botox afterwards, but I'm not really keen on Botox, to be honest. And basically a facelift is probably going to be what I need, and so that's I'm saving up for that. I did do a Photoshop of myself, and this is what I had hoped might be an outcome. But what he did say is if I did want them that full, he would probably need to give me some fillers, hyaluronic acid fillers afterwards. I have my favourite Amir Karam plastic surgeon on the YouTube internet. He does do fat transfer to the lips. Greg doesn't do fat transfer to the lips. I would be quite interested in trying fat transfer because it's permanent if I need it, and also microneedling. Quite a few people have said they've tried microneedling their lips. I have microneedled my lips for the past few months. Once a month when I do my face at home, I microneedle my face and I microneedle my lips to promote the natural collagen. So once they're healed and all feeling better, I shall be doing that to see if I can plump them up a little bit naturally. And Laura Devgan lip gloss, which costs a fortune, that also plumps your lips up a tiny bit, and you're supposed to keep using it in order to keep them a bit plumper. I'm not too sure about that. I'm not too sure they work as good as this. If you look at my eyelashes, they're my eyelashes. I've got no mascara on. I've dyed them, but I have no mascara on. These are my natural eyelashes, and that was NYK1 Lashforce eyelash serum. They've really made them grow long, so that's my tip for you. NYK1 Lashforce. I'll put a link down below. Anyway, next, the disclaimer. So once you've gone for your consultation and you've decided, yeah, I want to go for that, the disclaimer is pretty frightening. It's very long and lists anything that can go wrong, and etc, 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 which is why it is so vital that you make sure the surgeon you go to is someone you really trust completely, because that's enough to chase you away, to be honest. I did check with Greg that there were no nerves or muscles or ligaments around here that could accidentally be snipped and cause paralysis, and there wasn't, so that reduced the risk for me a little bit. Of course, there's all things in the disclaimer that it might not look like you really wanted it. The scar might not heal as well as you wanted it to be. Blah 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 blah. The day of the surgery, I drove myself there and brought my friend along, because it's local anaesthetic, as you would have in the dentist, a lot of it, and I thought, in case I didn't feel very well afterwards, I asked my friend to come along, and she very kindly agreed to come with me, and but it was fine. I drove home afterwards anyway. So that's the preparation. I arrived at 2:30, and Greg started scribbling on my face and working out how much skin to remove from here. He removed 5mm from the centre and 7mm from either side, and then there were 2 triangles here, something like that, and about 5mm triangle at the base snipped away, and I don't know about the inside bit, but there was a chunk out of the inside bit as well. So it was there was Greg, and then there was his assistant Garrett, a boy's name but she's a girl, and a student who's, sorry I can't remember your name, I think it was beginning with a C. He filmed everything with my consent. I said, this is going to help people learn about this, and if you know, if it's useful, I don't care. I'm not proud, you know, everyone can see what I've had done. I'm not ashamed. And then I had lots of anaesthetic, and the needles, you know, the needles, what can you say, it's a needle, it goes in and it smarts a bit, but it wasn't unbearable, and the chair was very comfortable. Greg put some music on. They asked me my preference. I said I don't mind as long as it's not heavy metal or medieval music or that twangy old Chinese and Korean music. I don't think I could have stood that for a couple of hours. So it was a good mixture of, you know, of retro stuff, so that was fine. So it was as numb as when you go to the dentist to have your wisdom teeth taken out. So it was, everything was numbed at this bit. He concentrated mostly around this bit first. That was the first plan of action, dive on this bit. And so then we started the procedure. And you can feel the nose, your nose being, it feels numb, but your nose is pinched and tweaked and moved and pushed and squished like constantly. It's hilarious, really. So you can, obviously trying to get under there is quite a difficult area to work on. So then the scalpel, I could feel the pressure of the scalpel on my face. It felt like as though if you get a pen and you draw on your face, it felt like that. So you could feel the pressure of it, and weirdly it felt cold, but it didn't hurt. It didn't feel, you know, you couldn't actually feel it go and slice into your skin. And then you can hear the zap 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 of the laser while he cauterized the vessels and to stop it bleeding. There are two layers of stitches, one underneath which is used with a dissolvable stitch, and so they stitch underneath first, and he said sometimes even 3 layers of stitches. And then the top layer of stitches are those black stitches or nylon stitches, not black stitches, but stitches that they stitch on top that can come out after 6 days. So that took about an hour, and then we had a quick break. I'm quite lazy, so I just stayed in that comfy chair, wiggled my legs a little bit, but everything was fine, and they had a little stretch, and came back and injected my bottom, all around my bottom lip and here, to let it go numb for a minute, and then started to do this, which was a little bit quicker, because I assume this is the fiddly twiddly part underneath the nose, because the nose obviously gets in the way. I could feel the blade cutting here. That was probably the most uncomfortable bit, that I could feel the scalpel at all. Was here, Pixie's behind the camera, so I have to keep an eye that he's not going to do something naughty. So yeah, so cutting here felt a little bit, I could feel it ever so slightly, but again, it wasn't painful. It was just uncomfortable for 10 seconds. So, you know, I could bear it. Then he cut into this, which was quite quick, because, you know, it's quite easy. It's easier here. Did that, stitched it back together, and then he put some Botox, 1, 2, 3, 4 little squirts under here, which was mostly to stop the muscles from overworking while the lip is healing, to promote lip healing. So that was the reason for the Botox, and in fact I don't think I can't even tell the difference. I do look a bit like a chipmunk, but, and anyway, so then 5 o'clock it was all done, 2:30 to 5:30, 2.5 hours, all done. Then Garrett cleaned me up, and they offered me a mirror, and I said, you know, do you want to look at that? Do you want to look in the mirror? I said, no, not really. I'll look at it in the mirror in 3 months' time. But, you know, had to look in the mirror. It's quite hilarious with the purple marks all over me. I look quite like a musketeer. And here's the picture. And so that was that. I mean, I was expecting to look like shit anyway, so it was fine. And I put my mask on. My friend was waiting in the waiting room, and I drove home. Before I left, I was given a couple of paracetamol for the pain, and but I mean, to be honest, the anaesthetic was still in effect. Then also a care pack, and in the care pack there were some creams, there was some arnica pills, some bromelain, which I couldn't take because I'm allergic to pineapple, a marble roller, an aftercare leaflet, some emergency numbers, and Garrett gave me her number in case there was any issues or if I had any questions. I could call her and, you know, say whatever. And so then I drove home. Then it was all fine on the way home, a bit trafficky because it was rush hour, but it's fine. Then when I got home, it was too late to go and get the prescription, and the prescription was massive. So I just took paracetamols all night long. So if you're getting surgery, I advise you to go and get so at least have paracetamols and ice packs indoors if you can't get the prescription on that day. That's my only criticism. I feel that I wish I would have gone there a bit earlier and picked up the prescriptions, gone and got the prescriptions filled and then come back, so I'd have them all ready for when I got home. It's recommended that you sleep sitting up, which I do anyway, and I don't know for how long, actually I didn't ask because I didn't care. And then the soreness that night was manageable with the ice packs. I just sat there with some ice just on there all evening. I just kept swapping them out. It's quite fine. A lot of drooling, just spit it. So tissues, a lot of tissues as well. So tissues, paracetamol, ice packs. Then I haven't really spoken much. It's been 4 weeks, and Greg advises to not move, you know, obviously not shout, not yawn, not scream, not talk a lot for 6 weeks, no laughing, which is very hard. I mean, when I laugh, I've got to kind of squash my face to try and stop myself laughing. I have taken my mask off now that I answer the door, and I look quite creepy trying to smile. Because the top bit, the bottom lip's actually quite flexible, but this top lip is quite, I suppose I could force it, but I'm not supposed to. I'm not going to yet. I'm going to let it all knit. So I was all ready to eat soup and liquids, and but the thing is, the liquids don't stay in. Even a glass of water just flew out. It was hilarious. So in the end I got a measuring spoon and kind of poured it in and managed to drink like that. But there was me with a fridge full of soups, and I couldn't actually take them. So I had a lot of mashed potato, hummus and custard. A few bowls of custard because I felt I deserved it. And then you can't really open your mouth either, so I was eating the mashed potato with a tiny teaspoon and putting it in my mouth to the back of my tongue and then swallowing. But you know, I'm a fat cow, so it wasn't any big deal. So you can't really suck on a straw either. I thought I could suck on a straw, but you can't actually. I mean, I can do it now, but at the time, a few days, in fact a few weeks after, you can't really. That sucky action is very difficult. So I went to the chemist, and on the list was Bran ointment, which is an antibacterial for skin infections, and that's what you're supposed to put on the scar immediately afterwards, and for you know, to keep you from getting infection. So I was a little bit worried because I couldn't get that ointment for 2 days after, and Garrett had smeared it all over me when I left. But obviously, you know, I wanted to have a wash that night, and so I washed some of it off, and I just put my Neutrogena Clean and Clear oil-free moisturiser on it, because that's got a little bit of an antibacterial in it, but obviously it wasn't as good as putting that Bactaban on. And then clindamycin, which is an antibiotic, that was for 6 days. Diclofenac, which is twice a day for 4 days, and that's a painkiller, non-steroidal anti-inflammatory, so that's in place of paracetamol. It's a bit stronger than the paracetamols. Then dexamethasone, which was 5 tablets spaced out across 5 days, decreasing, and they are corticosteroids for the inflammation. And then I get cold sores, which was my biggest fear, and so I had an Aclavir course before the operation and after the operation, just to make sure that while it was all raw I didn't get any cold sores, especially because your nose does run, and you know, because it's numb you can't really feel it, and you know, cold sores live in your snot, and so it was a little bit worried about that. Then paracetamol after the diclofenac is finished. The diclofenac is finished, so after the heavy anti-inflammatory painkillers are finished, you can go back onto 600 milligrams of paracetamols every 6 hours if you need it. This is what I look like the day after, and so pretty swollen, and I got the meds, and I tried as much as I could to get that purple pen off with some rubbing alcohol as advised. And to be honest, I managed to reduce it by a little bit, but it was still there. Trying to get that purple pen off was hilarious. Garrett texted me that next day to see if I was okay and doing all right. Day 6 the stitches came out, and this is what it looked like on day 6. It was all fine. I had a red light treatment afterwards, and there's a little tiny yellow kind of, I thought it was septic, but it's not. It was some kind of some tissue, healing tissue, just right underneath my nose, which I think that bit is probably the bit that had the like the sides went down really quickly, but this bit right in the middle of that junction, that cross junction, it was probably the hardest bit to deal with. So after 7 days the medication's finished, and I was on paracetamol, but to be honest, after a day I just forgot about them because it didn't really hurt. After 3 weeks the bottom stitches inside are dissolvable stitches, and after 3 weeks they had dissolved. I've just been documenting the swelling, how it goes down, and the healing. Everyone was quite, and myself included, was quite surprised at how quickly it actually heals. I mean, I was quite amazed that the stitches come out after 6 days, and it knits together, and it's not you know, you're not pouring me blood or anything. It's all fine. There was no blood, there was no crusty blood, nothing really. And yawning is impossible. You have to really suppress any yawns. You have to hold your face if you're going to laugh. Just hold it so you don't pull anything. Runny nose is the worst. I mean, I'm quite a snotty person anyway, especially now the weather's changed. You know, a bit of cold air and my nose just starts running. And like I said, I'm absolutely paranoid. I did get a cold sore. And I burst it, and there was some gunk came out, and then I put cold sore cream on it, even though it was right on the scar, but it was all fine. And then I felt a little bit, I can't really tell whether it's cold sores coming or the prickle, the natural prickle. So I just put some cold sore cream on it, just because. I wiped my nose with cotton buds at first, because you know, you can't, even a tissue felt a bit rough on the scar, and later under running water, you can just about, I mean, what I do is I use this, which is like a spray of salty water with magnesium, this one, because it's for hay fever. I'm probably going to bugger up my lens now and make it look like it's raining. But you can stick that up your nose, and then under hot running water, I kind of blow it out, which is really disgusting, but I found that was kind of quite an effective way of clearing one's nose without actually having to wipe with a tissue. I mean, now I've progressed to rolling up bits of tissue and sticking them up there. Taking an antihistamine just to stop my nose running is also something I've been trying to, you know, prevent any snot coming. Brushing your teeth. Brushing your teeth is very difficult. If you've got a toothbrush, I think that's going to be even harder. So if you have an electric toothbrush, then it isn't too bad. You can actually, especially the day after and the night of the operation, you can actually get quite in there, and with an electric toothbrush, you can just about get to the back teeth. I like to use a tongue cleaner, but to be honest, that was very difficult because depressing it down onto your tongue makes this stretch quite a lot, so that was quite difficult. You just have to try. But flossing is pretty impossible unless you've got gaps in your teeth. You can use the little flossing brushes, but using cotton floss, waxed cotton, is quite difficult. I've only just managed to start flossing after 3 and a bit weeks. I would just forget it, and you know, it's not going to kill your teeth for a few weeks not to floss. Looking like Frankenstein, obviously, but with the coronavirus, you can just shove your mask on, put your mask on if you need to go out. And don't forget to put the cream on that was provided with the sunscreen on the scar, and it's probably good to put that on anyway. Then the back to Bran ointment is super greasy. It's disgusting, and it seems to just spread all over your face and make you have spots and blackheads and awful stuff. So you have to bear with that for a few weeks until the stitches come out, and then you can start on the Louis Widmer eye cream, which is what Greg recommends. It's supposed to have amazing healing properties. I've just stopped using it because I feel my skin maybe was a bit sensitive to it. I've now switched to this cream, which is highly recommended. It is Kelo-cote UV silicone gel, which you can put. This is quite sort of oily feeling as well, but you can put a tiny bit on there and it softens the thing. It's supposed to have, it's quite expensive, mind you. That was £22 for that little tube. So yes, and then 2 times 30-minute walks a day was advised. I personally did 20 minutes on my vibrating exercise plate on a low setting. And then eating is horrendous. It's a really messy affair. If you have watched my vlog, my Korean art of seduction, K-drama style, you will see in that Korean, to seduce your Korean man, they actually like if you eat really well and get it all over your face. It's quite seductive, apparently. So you're well in there, but have lots of wet wipes to hand because it just goes everywhere. You can't open your mouth to bite down on anything. Keep it soft, and cut things into small pieces. For the first few weeks use a little teaspoon, and then maybe as these heal a bit, you can just get a fork in there, but small bits, and wet wipes. Then numbness and tingling. It's very numb. This here feels very weird. It's like prickly caterpillars. It even feels like it's got their like cactus. It just feels like a cactus. It felt like the anaesthetic from the dentist, or the anaesthetic felt like the anaesthetic was, you know, almost worn off for weeks and weeks and weeks. And the nose in particular was numb and felt so peculiar for a long time. I mean, I've just about got the sensitivity of my nose back now, and this is all hard and quite stiff. This is softening up now here. The bottom lip has softened up quite a bit, but after eating it swells up, you know, swells up, goes down. Very peculiar. You don't look the same every morning. It can take up to, apparently most of the swelling will be gone after 3 months, but it'll take up to a year to really settle and for any numbness and tingling to go away. And I'm not sure how long the redness will still be there. I mean, I could cover it up with makeup. I've put my makeup on today just around it, but I could have probably covered that up with makeup a little bit if I wanted to. Then I actually have a red light machine. Hang on, this will be hilarious. Ready? I have a red light machine that I got out of the cupboard, and I've been doing that to help heal my scars a little bit and cut down on inflammation. And also I had this at home, which is like, it's a vibrating face thing that you put a brush on it and you scrub your face with it. And I kind of gave up with it a long time ago, but it's actually quite nice. And I've been putting that on my scar and on my nose, and I think it's actually helping. Just you know, instead of giving it a hard rub, doing a little vibration. I mean, obviously if you have a lady vibrator, you could probably use that. I don't know. As far as satisfaction is concerned, I mean, I'm so pleased that I'm starting to look like I used to look. I'm reserving judgment until they're properly healed, and because my face, like I said a minute ago, my face changes every day. I mean, it's only today that I don't look weird. I look like a man yesterday. My lips, the size change. They change throughout the day. In the morning they can be quite swollen up. By the end of the evening they can just look like all the blood's gone from them, and they look like they've just disappeared because they're quite pale. They sometimes they look like a doll, like you would have on a bisque doll. They look like they've been painted on, a really strange shape, like a dolly's. And then another time I just look like the pointy, like when the geishas, it looks like this. So I look like a bit of a geisha. And I wonder, are they just going to shrink and disappear to nothing? Or sometimes my face looks really swollen and round, or like this bit here looks like I looked like a chipmunk for a long time. I really did. I looked like I'd stashed some nuts in my cheeks. Will my marionette lines look worse? You know, will I have it's early days, so I'm reserving all my judgment. And you know, I do wonder, once this starts moving, will I still just be very bottom teeth heavy when I talk, or will you actually see my top teeth when this lip starts moving? when I lose all my weight, I have lost over a stone now, yippee! Will my lips look nice and large against my small face? That would be nice, wouldn't it? Or will they just disintegrate with the fat? Let's hope not. I do look a lot like I've been, this here makes me look like I've been blowing my nose constantly, or been eating raspberry lollies, you know, like you did when you were a kid, eating lollies and you have red raspberry stain all around your chops. It is quite pale and red and tight, so and I do wonder as well, like I keep looking at my nostrils, wondering if it's dragging my nostrils and making me look like a piggy. I mean, obviously it is tight, so it probably is pulling that down a bit and making my nostrils look a little bit bigger than usual, and it's swollen. But then I think if I hide that red bit, my nostrils probably look normal like they usually do. It's probably just a visual. It's probably just a visual effect that they look bigger. I mean, that is something that can happen, that the skin, as the skin tightens and the stitches, obviously, while it's softening, your nostrils can look a little bit bigger. So I'm reserving judgment, so no panicking. I mean, I'm not unhappy. I don't think, oh my God, I've made a mistake or anything, nothing like that. I just think, you know, I'm going to wait. I'm going to be patient and really see what it looks like when it's properly healed, and how big they look, and, you know, whether I think I need to go and get something put in them to make them look a little bit fuller, or you know, maybe they just look marvellous, which is what I really hope for. So I'm quite stingy. It'd be nice not to have to spend any more money on them. And, you know, maybe with the micro needling, it will just plump them up a little bit very naturally. And so that's it really. That's my that's my 4-week mark little video on my lip lift, and I hope that's very useful for anybody who is thinking of getting this procedure. Just make sure you fully trust your surgeon like I did Greg, and his details are down below. I think that's all I needed to say for now, and Annyeong, have a lovely day, and I hope that was useful.